Hi, my name is John from Genesis Baby and Toddler Swim School, the home of a heated pool where we follow a SwimAustralian curriculum for babies and toddlers across all stages. No, this is actually not true, and it's in fact a myth that babies are born with the ability to swim. However, babies have the natural tendency and ability and reflex to be able to hold their breath, which is what we call breath control. When they are 3 months of age, we can actually start with some simple home practice tips of what we call conditioning or water conditioning when it comes to our babies. And for swim lessons, it's advised to start their swim lessons as young as 4.5 months of age, where they have good control of their limbs and also decent control of their neck and spinal cord. Warm water or a heated pool is definitely better for babies to pick up their swimming skills in. This is because when they are really young, when it comes to water survival skills and swimming skills in general, it can be really difficult for babies to pick up the reflexes related to it. So being in a cold water can be very difficult for them and may also create a sense of panic. However, learning in a heated or a warm pool can allow them to relax when it comes to their ears, their necks, and overall their face when it comes to submerging in the water as well. However, after a long duration of lessons in a warm water, it is advised for parents and their caregivers to once in a while, when they have holidays or staycations, to expose them to cold water as well. So their survival ability is not just limited to warm water, they should have the ability to not panic when it comes to cold water as well. It's totally not okay to use neck floats when it comes to babies because firstly, it creates a strain when it comes to their neck and their spine. This is exactly why a lot of councils affiliated with baby and infant education strongly advise against it. Secondly, using a neck float always puts the baby at a vertical position in the water. This is totally wrong as well because when we want them to pick up swimming skills and water safety and water survival skills, we want their body to be horizontal. Being vertical is totally contradictory of the survival position, where we always want them to be horizontal, we always want them to float on their back in order to breathe efficiently as well. Before bringing your babies to any swim lessons, firstly, you can make their bath time really fun. And it's as simple as by using a cup like this. By taking a cup like this, you can start with 1/4 of a cup of water and you can expose water pressure around sensitive regions around their head. The first sensitive region, their ears and behind their ears. This is very important when it comes to building a reflex on floating on their back. The second region where you can expose them to a lot of water is on their neck. Also to do a lot with floating on their back, and it's just going to get them more and more comfortable when it comes to reacting to water around their head. Lastly, the most important is what we call balloon cheeks. Very simple. You take 1/4 of a cup of water and we do this by mimicry. When you're ready to pour a little bit of water on your baby's face, you go ready, 1, 2, 3. You pretend to take in a big gasp of air. When you repeat this motion again and again by showing it on your own face and alternating it on your baby's face, they start to mimic you and also build a natural reflex of breath holds and breath control. This is really going to help them to submerge in the water and learn more complex survival skills. It's absolutely safe to bring our babies and toddlers to the swimming pool. We need to make sure that the pool is maintained on a very regular basis. The pool also should not have a very high chlorine level. There are a lot of public pools and common pools out there which have a chlorine level of more than 4. We should always ensure that the chlorine level ideal for babies and toddlers are safe to be between 2 to 3. And anything above 4 might cause irritation on the skin, might cause redness in the eye, and all sorts of other factors. The pH of the pool should always be between 7.2 to 7.5, so it's very close to neutral and slightly alkaline. All of these factors put together will give you the maximum comfort for your little swimmer. Furthermore, after taking your little ones to a swim, it's strongly advised to use a swimmer series after swim head-to-toe care, which is basically a soap and shampoo, which is a 3-in-1, and it's specialized in removing chlorine, bromine, and all sorts of salt water, which is going to remove all sorts of impurities from your baby's skin, at the same time leaving it with maximum moisture as possible. If you're interested in knowing more about these products, you can always ask us, or feel free to come by Genesis to pick it up as well. When we say toddlers, we often refer to children who are at the minimum age of 2 years and above. So toddlers often in swim lessons, firstly, we focus on the ability to submerge their face in the water. Why is this so important? Because they need to know how not to panic in the water and how not to drink water when it comes to any crucial moment as well. After this, we focus on basic swim strokes, which allows them to achieve small targets of 3 to 5 meters, where they can hold their breath and conquer the distance as well. Finally, the most important skill to be taught, after they've picked up these 2 crucial skills, the third one would be the ability to change their breath. So toddlers have 2 crucial ways when it comes to changing their breath when it comes to survival swimming. Firstly, what we call is a rolling over. Rolling over is very important because if any time a toddler falls into the water, we teach them how to float on their back and catch their breath. And secondly is what we call a turtle head breathing, where we teach them to lift their head out of the water. Of course, this is only after their strokes. When it comes to their kicks and their arms are pretty much better. Finally, we just want them to have a lot more fun, have bonding with their friends, and of course conquer their biggest fears when it comes to water. This overall helps their confidence in all aspects of life as well. If you are a parent and you're a non-swimmer, it is in fact totally safe for you to bring your baby or your toddler to the swimming pool together with you. However, you have to ensure that the depth of the pool does not exceed about 1.2 to 1.4 meters. This is because you would be able to stand with your upper body and your head comfortably out of the water, and at all times you'd be able to maintain a safe position while carrying your little one as well. For instance, we can see in this video where you seat your little one comfortably on the surface. Make sure that they have good balance. With one hand holding your child and your elbow rested on the ground, you want to place your other hand across the child in a safe position, so that this is to ensure that you have good balance and you do not slip. And on the count of ready, 1, 2, 3, without hesitating, you turn yourself into the water like how you see in the video. Make a good eye contact with your little child and give them a little kiss on the cheek. Swim teachers are qualified and where they have received their training and certification from. For example, here at Genesis, all our teachers are SwimAustralia and SCTA, which is the Swim Coaches and Teachers Association in Australia, accredited, and all our curriculum, program, training methods are all following their guidelines as well. We have constant monitoring of teachers' performances and constant upgrading of their abilities and new skill sets to impart to the kids on a quarterly basis. Moreover, it's also important to know whether your teachers are equipped with training and certifications such as CPR, first aid, AED, and also basic life saving. All our teachers and staff here at Genesis have all these accreditations mentioned for the maximal safety for your little swimmers. Here at Genesis, our curriculum has over 15 levels, starting from as young as 4.5 months of age, across toddlers, preschoolers, and also our kids till the age of 12 years old, where they go for their pre-competitive swimming stages. The classes are often fast-paced because we follow a motto called maximum practice time, which is a strong motto always emphasized by SwimAustralia, which says that children having minimal attention span should be encouraged to follow a maximum number of skills during their swim lesson. Since the swimmers are allocated to their specific levels in the classes, teachers closely monitor their progress throughout the term, and at the end of every term, we give our little swimmers their certificates which mark the key milestones of every level they complete. At Genesis, we also have Genesis Baby and Kids Fitness, which focuses on gymnastics programs for infants starting from 6 months of age, and toddlers, preschoolers, and kids until the age of 12. Furthermore, we also have a dedicated holiday program which happens twice a year during long school holidays, where it's an initiative to keep our kids away from their gadgets and in fact make core memories with a large group of their friends, and have an incorporation throughout the whole week with swimming activities, gymnastics, parkour, outdoor activities, and many, many more. All these instill strong attributes in them and give them a very productive school holiday.